You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host, John J. Tassoni Jr., with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. Call URI, you can get it. You can go to your pharmacy and get it. Put it in your pocketbook, put it in your car, take it out of your car at night. It saves lives. We're losing too many young folks with overdoses. My guest today is Juliet Holtzman, and she's with the Brown University Health, the new name of the old name of the new name. So Welcome, Juliet, and thank you for coming on today.
Thanks.
I want you to talk to my viewers pertaining to what Brown Health is now doing within Rhode Island Hospital.
Yeah, absolutely. So Brown University Health, specifically at Rhode Island Hospital, we have a brand new bridge clinic, kind of an urgent care for addiction. It's called Addiction Care Today, or ACT. And basically it's a walk-in, no appointment necessary, to be seen by someone like myself who specializes in addiction and also an addiction medicine provider, to either be reviewing med management, detox protocols, and they can also opt in for counseling with myself. And they can be referred elsewhere as well for additional care.
When did you open?
We actually had a soft opening starting in March. So,
okay.
Yep.
Now you're up and running. A lot of folks visit the clinic?
Yeah, we're doing pretty well. We get a lot of walk-ins, a lot of people just calling to inquire what we offer, and we can provide appointments if scheduling something is more feasible for them. We get people calling from pretrial services, people who may have an appointment a couple of weeks out for med management but need a bridge script for like Suboxone per se. So we're getting an array of people, all different substances, all different walks of life. So
that's an interesting concept that you just said about all the different substances that are out there. Obviously, it's not just one or two anymore, it's multiple. It's multiple. Now, where are you located?
So we're on 2 Dudley Street in the Medical Office Center, Suite 375. It's very easily accessible. We have a garage nearby. We validate parking. People can walk in through the emergency room and get towards us. We're right next door to it, so it's really easily accessible. Now,
do you also have people within your office write scripts if people need scripts? Or how does that work?
Yeah, so if somebody walks in and they're struggling with, let's say, opioid use disorder, using fentanyl, and they're ready to get on med management, they would meet with myself, kind of do a pretty quick intake. We're not here to keep anybody there more than 1 or 2 hours long. Kind of get the history, see what their goals are, and how we can accommodate. Then they can meet with a med management provider to start a home induction on Suboxone or any other medications that may be suitable for them.
So I'm a little confused. It's not hard for me, but med management.
Yes.
What does that consist of?
Medication management can consist of any medicines that can assist with recovery from substance use. So, for example, opioid use disorders, the common ones are Suboxone. We also do the injectable forms of Suboxone, so that's Sublocade or Brixadi. Those are once-a-month injections. If somebody has an alcohol use disorder, we can evaluate them, see if they're eligible for our home detox, so home withdrawal instead of going inpatient, or we may recommend inpatient. We do the anti-craving medications for alcohol, including the injectable version of those meds as well. So we treat stimulant use disorder, anything under the sun.
So it's a whole array of a menu.
Yes, exactly.
That you take care of. What about age groups? Do you do adolescents? Do you do... Tell me about
the
that.
awesome thing about ACT, Addiction Care Today, is that we are able to see and also assist with medications for 16 and up. So anybody who's struggling with a substance use disorder, we can see them, assess, do counseling and medications for any substances starting at age 16.
Are you seeing any of these clients through the court system?
Absolutely. Yeah, I work very closely with pretrial services. So anybody who goes through that system and the court is asking, you know, hey, we're kind of wanting you to go get a substance use evaluation. We're getting a lot of those, and I think the good feedback that I've gotten so far is that we have a lot of flexibility and openings, so we're getting them quick. So, you know, if they're calling around and it's hard to get into an appointment soon, you know, a little later, and court's coming up, we're pretty flexible, which I think is great.
Now, what about adolescents? Are you getting them to the family court system also?
So I've worked a couple of cases with DCYF, and also we've been getting some referrals from Hasbro Emergency Room. So anybody, you know, that they are meeting with struggling with a substance use disorder, they have been inquiring about our services and getting them seen through us.
You know, there's been many times that information that gets back to me is that a lot of these adolescent children have to go out of state to get residential treatment at the tune of anywhere between $10 and $15 million. But if we have a system in place like yours that will take 16 and up, it should save the state a little bit of money.
Yeah.
Now, I'm not sure what the numbers are prior to 16. I know that our organization got a call a few years ago pertaining to 6th graders with alcohol use issues. So it's happening. It's happening more frequently than I would hope.
Yeah.
But at least now that we have someone as educated and that can help with this problem.
Yeah.
But you're not a residential treatment
We're
place.
not residential, so we're only outpatient.
So what do you do?
So what do we do with them? So, I mean, we do work closely with Bradley, and they have their great intensive outpatient programs for adolescents with substance use disorders, and kind of just trying to see, is med management also an addition to receiving those intensive counseling? Because as we know, you know, I've worked with this population since 2012, and majority of the stories are people start using substances at a young age. So if we can intervene earlier on, you know, with counseling, but in addition to med management, I think that would, you know, hopefully lower those numbers of requiring residential treatment.
Yeah. Now, is your organization look to expand to different parts of the state, or just to stay within the city of Providence?
I think our hopes, you know, are, you know, with the new expansions of new hospitals that we have, and, you know, including like Newport, we would love to kind of inquire more about how much more we can help.
Yeah, we're getting a lot of calls from the South County area pertaining to issues with substances and mental health. So it would be a good asset to you know, South County area if you guys can put like maybe even a satellite type office over there to give them some help.
Absolutely, yeah. We've already kind of worked a couple of times with some social workers at Newport Hospital, and we have been able to get a few folks into residential treatment, so inpatient addiction treatment. We do offer telehealth services, so you don't actually need to come in to meet with any of us, even on the first appointment.
Yeah, I want to talk more about that when we come back, because we're going to take a break. You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Juliet Horstman is in the house, and she's with the Brown University Health. So welcome, and thank you for joining us again, and thank you for what you do.
Thanks.
A lot of people need the services that you all provide, and it's very much needed. I want to talk a little bit about, from the last segment, the telehealth. What are you doing with telehealth now?
Telehealth is amazing. It is reaching out. We live in a very small state, but a lot of us also don't drive very far. So
Right.
sometimes this opens up an opportunity for folks who are in South County or northern Rhode Island who may have limited transportation access to get a visit from myself and from a medication provider if needed to establish what their goals are, treatment, and we can continue telehealth. We don't have a requirement for people to come in, as we know it's difficult. We may ask once every so often for them to come in person, but we are very flexible and we do enjoy using telehealth services.
Telehealth, you must see the individual, correct?
Yes, yeah.
It's not like you can turn the camera off and have a conversation. You have to see face to face.
We definitely prefer seeing people in person. There have been occasions where sometimes that may not be able to happen, so we just try and be as, like I said, flexible and accommodating as possible to meet these people's needs.
Julia, what about your staff? How many people do you have on staff, and what are their credentials?
Yeah, so we have an amazing front desk staff named Sam Kaplan. He is also our peer navigator, so he'll help folks with, you know, any issues around finding a new primary care doctor, dental, helping with insurance issues, setting them up with MTM transportation, those kinds of case management needs. He's fantastic. Monday through Thursday, we have a addiction nurse practitioner named Sherilyn Freitas, also amazing. She's worked in Bridge clinics in Massachusetts before, so she's extremely knowledgeable. And then on Fridays, we have our Director of Addiction Medicine Services, Dr. Cecilia Fix on Fridays. And then you just have me. And so I'm a licensed independent clinical social worker, and I also have my license in chemical dependency.
So you got a well-rounded group
Yes, very.
that can see patients and that can navigate through the most horrifying thing that I find in talking to folks is the navigation of the system.
Yes.
There's so many red tapes, the doors are locked, they have to go to this door, go to that door. But if you can get someone like Sam that can navigate through the system, he's worth every penny you pay him.
Absolutely.
Every penny.
Absolutely. It's mental health and addiction, but also these caveats of the insurance, transportation, housing, food stamps. They're very messy to deal with sometimes and kind of complicated, and you're trying to read websites and navigating, and when you're also struggling with substance use on top of it and everything else, it's really hard to navigate. So one of our goals is to continuously provide really good care and assistance with getting those needs met.
Yeah. What about harm reduction? There's been a lot of talk about harm reduction, harm reduction, harm reduction. Give me your elevator speech on harm reduction.
Harm reduction is amazing. It does a lot. I think a lot of people may still need to have more education about what harm reduction is. Harm reduction, in my opinion, is something that helps save lives. It's just Narcan. That's harm reduction right there. So when you come to our office, your goal doesn't necessarily have to be abstinence or complete cessation. It could be, I want to use more safely, which can reduce my risk of hepatitis C, endocarditis, or other infections. How maybe I'm ready to not use one substance, but I'm still kind of wanting to use the other. How can we safely understand what that person wants, and how can we safely educate them to use in a way that reduces harm to themselves over time?
So there's a lot of misconceptions about harm reduction. Well, you're going to let those drug addicts come into your place and use drugs? Yeah. So you get them in, and then you can talk to them about getting treatment, getting education, and prevention.
Exactly. The whole point is engagement. If somebody feels safe, heard, and respected on their stance, they're likely going to come back. The more times they come back, the more seeds I can plant, and that kind of expands with how do they change over time. And that's with the support of everybody gathering around them and giving them those resources.
There's so many kids and adults now that are not getting the right medication if they're in pain. And they absolutely go to the street to get their drugs. And unfortunately now, as we all know, this fentanyl is the killer of all killers. Stops your breathing, automatic death if you don't have Narcan or people don't know CPR. how do we get more education in your mind, because you're a young lady, to the people on the street to say, listen, if you can't get what you need, don't go to the street. Go to a harm reduction facility.
Absolutely. Yeah, I think there's a lot of great organizations that are doing it already. It's really just boots on the ground, very grassroots, just going into the community and talking to people, seeing what their thoughts are and how we could best address what their needs are so that they understand where the safe places to go to receive the care that they need, instead of turning to unpredictable drug supply that can very much possibly kill them or make things much worse.
So your organization, even though, like, if I came in and I needed residential treatment, you could set that up.
Yes.
Make a phone call,
Yep.
whether it be AdCare, Zinnia, or whatever the others that they may have for support. You can take care of all that.
Absolutely. So when you meet with me for an intake or a session, really it's just trying to understand what your goals are, and if we kind of determine I need to go to inpatient for a couple of weeks, then we explore that. I make a couple of phone calls, I see what the bed availability is. If there's no beds that day, what can we do to safety plan until we can get you in somewhere?
And that's a big deal. I want to talk more about that when we come back. You're watching Recovery TV, and I'm your host, John Tassone. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassone Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassone. Juliet Holtzman is in the house from Brown University Health, and we're talking about her organization that's at Rhode Island Hospital, and their phone number is 606-8100. Juliet, thank you for coming on, and thank you for what you do, and thank you for Brown for putting this thing together. I think this is something that can be used quadrantly within the state, so we're not plugging up the emergency rooms, and it's not getting any better. It's getting worse. People don't like me to say that, but it is. You know, we have to be honest with ourselves to get these people the treatment that they need in order to become productive citizens, rather than go to a funeral home for a funeral or a wake. We need to get these people back on track. So tell me about the goals of your organization moving forward.
Yeah, so right now we're open Monday through Friday from noon to 4. I think within the next month or so we should be open full-time, so from 8 to 4. And I think ongoing goals are just kind of continuously spreading the awareness that, hey, we're here. We are here to have you get seen ASAP, quickly, in an urgent matter, get seen by a doctor who understands what you're going through, and get started on medications right away. We do have medications on site within our clinic as well, so if someone's in severe withdrawal and just isn't able to do an intake, we can give them Suboxone or any other meds.
You also have the capabilities, if you can wheel them across the street to the emergency room?
Yeah, so we're actually right next to it. So you go down the elevator and the emergency room is right there.
God forbid something was to
Exactly.
happen.
So that is a really awesome thing about our clinic is, God forbid if anything were to happen or somebody is really decompensating from their withdrawal syndrome, we can easily get them right into the emergency room from there.
It's a win-win for everybody. It's a win-win.
Yeah, I think so. Just spreading kind of the word to other emergency rooms that we are open and exist. So if you're discharging someone and they're in need of emergent scene, like to get started on meds, they can come to us. And I think our final goal is we are pretty close to getting methadone on site as well.
I want to thank you for coming on and thank you for what you do.
Thanks so much.
It's great to have you on. So ladies and gentlemen, Brown University over in Rhode Island Hospital. Give Juliet a call, 606-8100. Next week, my guest is Rye Cares is in the house. Have a great week. If you see something, say something.